The Omicron variant is dominating all the talk around the pandemic, it seems. Can it evade the vaccines? How sick will someone get? Do I need a booster? I'm Tanya Rivera. From now until 6 o'clock, we're digging into those questions. And we're going to start with what state leaders say about what North Carolina's response could look like. Health Secretary Dr. Mandy Cohen testified before a state Senate committee yesterday. She says the state has a much better capacity to deal with the pandemic of right now than it did back in 2020. So Dr. Cohen doesn't see any more lockdowns coming or remote learning, but she says she can't rule it out.
Could this virus completely change and evade our vaccines, change the way it's transmitted? Sure. I don't want to sit here and say never, never, but I don't see that in our future.
Lawmakers also asked Dr. Cohen about why the state remains in a state of emergency nearly 2 years into the pandemic. She says emergency orders give the state flexibility that it needs to do things like allow pharmacies to give out vaccines. Well, we've dealt with variants before, right? But what makes Omicron worth all the attention that it seems to be getting? Well, doctors say it has more mutations to its spike proteins, those little points that are all outside. Okay, so the Omicron variant has 30 mutations. That's nearly twice as many as the Delta variant. Doctors say that makes it more likely to evade our vaccines, and they're still researching by how much. Vaccine companies started testing their shots against the new variant once it got discovered. Pfizer, in fact, released data saying 2 doses might not be enough. CBS' Natalie Brand digs into what the company says its next steps are.
But if you get the booster, you're really in good shape.
President Biden welcomed new data about Pfizer's coronavirus booster shot, which found it increases protection 25-fold against the Omicron variant compared to the initial 2 doses.
If ever there was a clarion call for people who are not vaccinated to get vaccinated and those who are vaccinated fully to get boosted, the new challenge with the Omicron variant clearly is that.
Cases of the highly contagious strain first detected in South Africa have now been reported in at least 20 U.S. states. Scientists say initial data shows the Omicron variant is less severe than the Delta variant. Delta is still driving a surge of infections and hospitalizations nationwide.
Unless we really double down on what we're doing, we could see an increased spike that goes even higher than that as we get deeper into December and January.
While the Omicron variant has sparked a rise in booster shots and vaccinations, a group of lawmakers wants to try and block President Biden's vaccinate or test rule, which would apply to millions of American workers.
Democratic Senators Joe Manchin and John Tester have said they support the Republican measure, which is expected to come up for a vote Wednesday.
I'm vaccinated. I encourage people to get vaccinated. But I don't believe that that's something the federal government can mandate.
The effort is largely symbolic since it's unlikely to come up for a vote in the House.
Our Republican friends are going to come to the floor to push an anti-science, anti-vaccine proposal.
The vaccine requirement for businesses of 100 or more employees is also facing legal challenges in the courts. Natalie Brent, CBS News, Capitol Hill.
Pfizer says it could have an Omicron or Omicron, depending on how you say it, specific vaccine ready by March if needed. Now, an infectious disease expert from Cone Health says the new data reinforces the need for booster shots. Dr. Cynthia Snyder told us doctors are still sorting out a lot about the new variant. She says one thing is clear, though. If you are vaccinated and boosted, you are better protected.
It's important to get that 3rd dose to get your levels up and provides a bit more protection. If anybody's been waiting to get their booster shot, this is the time.
Dr. Snyder says people should continue using other tools like masks and hand washing. Now, researchers from Duke University developed a new antibody rapid test that could give people a better idea of just how protected they really are. Here's how it works. Researchers add a little bit of plasma to the test, and that plasma has antibodies in it. Researchers then can test that plasma solution to see how it interacts with the virus. If it blocks the virus from binding to a cell, you have some protection. The lead researcher said this is a big development and more work needs to be done.
It's important to have those surveillance systems in place, but then also having some tests that you can use to hopefully get some information about, how protected you might be after vaccination from this new variant and things like that.
South Africa has one of the first countries to report Omicron cases. Doctors say they noticed a new trend with the variant. People are not getting as sick.
And what that tells us is that we're building up some level of immunity, even against Omicron, which is adequate to prevent that progression from infection to severe disease.
Experts say that's because of T-cell immunity. People develop them after getting infected or getting vaccinated. They prevent people from getting really, really sick. Now, the CDC director says U.S. doctors have mostly seen mild cases here as well. They still need to do more research, and the data out of South Africa needs a little bit more context.
What we don't know is if those people that have broken through in South Africa, many of them may have had prior COVID and others have had some protection. So we really don't know.
Dr. Agus says we need to wait for other countries like Denmark and the UK to finish their studies. They have very similar medical systems to ours. He says that data could be available in the next week or so. A new University of Oxford study says mixing vaccines could offer you the best protection against COVID-19. The study included more than 1,000 people. Participants got a Pfizer shot, then a Moderna shot 9 weeks later. The study found those people got a bigger immunity boost than people who stuck with the same brand.
And we're showing there is flexibility. You don't have to stick rigidly to receiving the same vaccine for a second dose.
Overall, it seems that this strategy is something that all type of vaccine could be benefiting from, and indeed different combination would still be extremely valuable.
Researchers say these findings could help poorer countries where vaccine supply of one brand could be running low. Well, that leaves two other big vaccine companies. Moderna says it expects its Omicron to make their vaccine less effective. Johnson & Johnson says it needs to do more research. Moderna's CEO says the company is already working on a vaccine specifically for this new variant. He says it could take 3 months to develop it. Johnson & Johnson is still testing their vaccine against it. It hasn't said when a new vaccine could be made. You know, there is still so much we don't know about this new variant. Here's the best advice that we've received from doctors, and that is let the scientists do their jobs. It will make this a whole lot easier for everyone as more data comes out.